Jenny, how are you going? Oh, goodness. Okay, so today we are going to go through a hypertrophy program for you, which is gaining muscle mass, maybe losing a little bit of weight. I've actually been referred to you by your doctor, and the goal of the program is to help you lose approximately 5 kilos of weight. You want to reduce your fat mass and increase your lean muscle because you have a BMI that puts you in the overweight category. So we're just doing it just to reduce the risk of you getting type 2 diabetes. So you have been previously screened as a low-risk 16-year-old female. Means you can participate in exercise from a vigorous to high intensity, which is from 70% up to 90% of your maximal heart rate, or an RPE of over 7. Okay, so before we begin any exercise program, we want to do a warm-up. The reason we do a warm-up is to slowly increase your body temperature, your heart and respiration rate, and to prepare your body for exercise. You don't want to go in there and start doing anything crazy and your body's not ready for it, because you will more than likely injure yourself. So we can do that on, say, the treadmill. Do a 10-minute warm-up on the treadmill. We want to get your heart rate from 40% up into 70%. We want to do that by gradually increasing the speed and incline of the treadmill. So we start, and the first 5 minutes we'll slowly increase the speed, and then the last 5 minutes of your warm-up we will continue at your 70%. So your body gets ready for the conditioning phase, which we'll go through now, which is resistance training, which is our hypertrophy program, and we want you to complete this twice a week. Right, we'll go through and demonstrate the exercises for you, and let me know if you have any questions. If you feel any pain at any time during any of the exercises, stop and let me know. And that should be it. We'll go through it. So the first exercise we're going to do is a dumbbell squat. We want to do it at an 80% intensity, and we want to do 3 sets of 10 reps. Yes, I'm correct, with a 60-second rest between each set. So we'll just do these squats with one dumbbell. So we're going to hold it in our hands in front of us. We want our legs to be shoulder width apart. We're going to lean most of our weight into our heels. So we're going to sit back in a chair. So we want to keep a neutral spine in our chest out and our shoulders back and down as much as we can. And we're going to go down as slow as you can with it, maintaining your technique and without feeling any pain. So we'll hold our dumbbell out in front of us, and go down, and then we push up through our heels back up to our starting position. And keep our chest up. And we want to do 10 reps of those, and as I said, 3 sets. When doing a squat, that's working your glutes, your hamstrings, your quads, and I have forgotten which one it was. Calves, of course. Alright, just give a quick, never mind. Quick walk around and just make sure your technique's correct. And it is, that's brilliant, thank you. Right, the next exercise we have is a lunge. That also uses the same 4 muscles that I just spoke to you about there. We want to do this with a dumbbell, and we want to do 80% intensity. So we hold a dumbbell in each hand, have our feet shoulder width apart, we take a big step forward. We want to be up on our back toes and pushing most of our weight through our front heel. We can get our position correct by doing proposal pose. We want to make sure we're at 90 degrees of back and front, and go straight up. Neutral spine, whoop, chest down, shoulders back and down, and just straight up and straight down. We don't want to lean forward or lean backwards because we don't want to hurt our lower back. And then you swap legs. Okay. We once again want to do 10 reps. I want to do 3 sets of 10 with a 60-second rest in between. It's really good, staying up on your toes. You're not feeling any pain in your knees or ankles? No? That's really good. Okay, the next exercise we have is bench over row. This exercise works your lats, your trapezius muscles and your biceps. So we grab our bar with an overhand grip, our feet hip width apart, put our hands roughly just outside our thighs. We slight bend in our knees and we lean forward roughly 45 degrees. We want to bring the bar up our body, up to our chest in a row. We want to keep our elbows in and squeeze at the top. Squeeze our shoulders up the top and then back down and fully release the muscle. Okay, neutral spine. We want to again do 10 reps and 3 sets with 60-second rest between. Right, are you comfortable with that exercise? Next is push-up. I'm going to show you on your knees, but it can also be done on your toes. So down on the floor, gosh, our hands just wider than shoulder width apart. We want to, chest height. We want to bend out our elbows and put our chest to the floor as well as we can, and then push up through our hands back into our starting position. We want to have our body like a plank. We don't want to lean our back forward or arch our back up because obviously we hurt ourselves. Right, and this exercise works our pectoral muscles, our deltoids and our triceps. And once again, there's 3 sets of 10 with our 60-second rest in between. Alright, got that one. Okay, our next exercise is an upright row. So we want to do 80% intensity. In upright row, we grab our bar with the overhand grip. And keep our hands right next to each other, maybe a little space in between. So chest up, shoulders back and down with a neutral spine, and we bring the bar up as high as we can, and then straight back down along the body. And we want to do 10 reps, 3 sets with a 60-second rest in between. And this is working the trapezius muscles, deltoids, and again biceps. Julie, any questions about that? No? Okay, next is our tricep extension. So once again, want to do 80% intensity. So we hold our dumbbell like so with our hands over the top. Goes back behind our head. We want to keep our elbows in as close to our face as we can. We don't want it to be out wide. And then we lower our dumbbell down and then straight up. And this, of course, is working your tricep muscle. And we want to do 10 reps and 3 sets. That's really good. You're not arching your back, which is great. Alright, any questions with the tricep extension? Alright, we've got our final exercise, which is crunch. So we use body weight for that. So lay down on the floor. We want to make sure we have a flat back. So the easiest way to ensure that we do that is to lift our knees off the floor. We can put our hands behind our head, across our chest, or out in front. It's entirely what you're most comfortable with. And then we just lift our shoulders off the floor until we can feel our abdominal muscles engaged, and then straight back down. And once again, 10 reps and 3 sets. And this works our abdominal muscles, our interior and our exterior oblique muscles. Alright, that's really good, thank you. Okay, so that is the conditioning phase of our program. So we want you to complete that twice a week. So we want to make sure you have a good 24 to 48 hours rest between when you complete it again. We also have a cardiorespiratory training program. Alright, so you should participate in continuous aerobic exercise from 20 to 60 minutes of moderate, which is 60%, to vigorous, 90% intensity, at least 3 times a week. Okay, because you're new to the program, you can start at 20 minutes, and then as you know, do do 20 minutes for the first week, and then the second week you can do 25 to 30, and we want you to be able to do it for the 60 minutes continuously. And you can do that on either the treadmill, a cross trainer, or a stationary bicycle. That's entirely up to you which one you favour. Okay, and then, oh, I forgot. Also, after you do both your endurance training and your cardiorespiratory training, we need to do a cool down. So the cool down will be, we did treadmill, didn't we? So we'll jump and get back on the treadmill for 10 minutes. So we would start the treadmill on a high speed. We want to decrease our intensity from our 70% down to our 40%. We want to do that gradually. And this will decrease your heart rate and respiration rates. It'll help with the removal of lactic acid in your system and reduce the potential for blood pooling and post-exercise dizziness, of course, injury. So we want to do that for 10 minutes. So 5 minutes slowly decreasing your heart rate, and then a further 5 minutes maintaining that 40% of your maximal heart rate. Okay, thanks, thank you. And we want to do that, I said, 3 times a week. Right, so we're just going to ask you a few questions for feedback. So I just wanted to see if you were satisfied with your resistance training. Yep. Okay, did you enjoy your program? It was great. It was great. Did the exercises suit your needs? Yes, they did. And did you have anything that you would like me to add or take away from the program at all? No? Happy?